Hi, I'm Dr. Mehboob, MD Ophthalmology from AIIMS New Delhi, and we have started a series of Take a Sip with OPHTHA Quick. That means where we will discuss very important topics of the whole ophthalmology in a few minutes, like 2 to 3 minutes, and you will be able to make most of the MCQs from that OPHTHA Quick only. So we have started with a series with the first sip, that is the corneal anatomy, and what better than the corneal anatomy. So let's start with this series. So you can see here the corneal anatomy. The cornea is the anterior most portion of the eye. It is actually covering 1/6 of the eye. Okay, 1/6 of the outer ball, means the 5/6 is the sclera. Second point is that it consists of these layers. The first one is the epithelium layer, the second one is the Bowman's layer, third one, that is the bulky part, is the stroma, fourth one is the Descemet's membrane, and the fifth one is the endothelium. Now what is this yellow color line? That is the sixth layer called the Duas layer. Since it is before the Descemet's membrane, so it is also known as the pre-Descemet's membrane. This Duas layer is named after a famous corneal specialist, that is Dr. Harminder Dua, okay, who has done a very important researches on the cornea itself. Second point that is important for the MCQ point of view, that many of the aspirants will forget the position of this Bowman's membrane and the Descemet's membrane. So remember that B is the first initial letter, right? Comes first than the D. That's why B is the Bowman's layer and it is up. D is the after in the alphabets it comes down, and D is also down, so it comes down. So it's very important to clarify these confusions here. Okay, now coming to the important point, that is the some aspects which is important for the MCQ point of view. This is the vertical diameter. The vertical diameter is 11.5. The horizontal diameter is 12 millimeter. The shape is very important. So let me draw the shape for you. Okay, suppose this is the shape. Okay, now this area is spherical. Actually this area is spherical, but the peripheral part is flattened. Okay, so that's why the coordinate aspheric means flattened towards periphery, and you have to remember this point. Okay, the fourth point that is very important, which can come as a statement in the options, that is it is thicker towards periphery. So don't get confused by this thicker towards periphery. Yes, and the fifth thing, that is it's avascular and transparent. Why it is transparent? There are so many reasons for the transparency of the cornea. One, it is avascular. Second point, that the collagen, the arrangement of the collagen in the stroma is parallel. Third, there is a negative destruction or destructive diffraction takes place when the light enters into the cornea. Fourth, the most important is the endothelium, which is the most considered to be the most metabolically active part. This endothelium is considered to be the most metabolically active part of the cornea, and it has a pump. That pump is known as sodium potassium ATPase pump. Okay, this keeps this cornea in the relative dehydrated state. The word relative dehydration is very important. Okay, and that's why this is transparent. The most important thing, that its nerve supply is very important. This nerve supply is by the nasociliary nerve. It is a branch of ophthalmic nerve, which in turn this ophthalmic nerve is a branch of, obviously it's a branch of trigeminal nerve. It's the first branch of the trigeminal nerve, and that's why we have completed our first sip, that is corneal anatomy. For the detailed discussion, you will be getting this detailed discussion on the corneal anatomy on my app, that is Ophthalmology Wizard. Okay, so please do watch the second sip of this. It will be very interesting series. Thank you.